Hello, everybody. You ever seen that control room before? Can you all see that too? It's weird. Looks like we've got just a few more people. Got a good chunk of people coming in all of a sudden, so we'll give them a minute to all get in here.
Prevention. Action items for year one that are still in progress are increasing local government staff capacity, creating the Welcome Home engagement program, supporting Ready to Work, and designating a lead service provider for a family system. Some updates on some of those in progress items for creating a Welcome Home community engagement program. This is really embedded in the landlord initiative work and the work plan that was developed. And that is underway. There's a tentative Key Heart training date of 10/28 and 10/30, and that will launch the landlord initiative work plan. From there, the housing stability cohort will initiate after that training with all of the attendees completing this action item and officially launching the cohort. And I do plan on presenting on the landlord initiative at Change the Trend meeting right after this one to gauge interest with community partners. For designating a lead service provider for family systems, I plan to engage with potential providers and iron out details for what being a lead service provider for the family system will look like. I did begin a work plan, and I plan to complete that work plan within the next 30 days, and once all of those details have been ironed out. Year two action items that were completed were streamlining volunteer and giving opportunities, and creating a lived experience advisory board. And these are all under the Building a Strong Foundation. For developing a single adult system, coordinated outreach team was launched with All Health Network. And action items that are still in progress are creating a central navigation system, piloting safe parking initiative, promoting shared housing, strengthening outreach to landlords, and these are all under developing a single adult system. And for developing workforce programs, engage with AD Works. And lastly, for developing a family system, piloting a peer support specialist program to outreach families and explore expanding HCB to families are still in progress. So some updates on some of those in progress items. For piloting a safe parking initiative, the working committee kickoff was on September 4th, so 2 weeks ago. And it was decided that there will be bi-weekly meetings. So the next meeting will be on the 18th. And I'll speak in more detail to this a little later on. And for strengthening landlord outreach, the Landlord Outreach Initiative work alongside Arapahoe County, the work plan is in place and it's underway. As I mentioned, the Key Heart training is scheduled for the 28th and 30th. It'll be 2 half-day trainings, and that will officially launch the cohort. For developing a family system, I met with the HUD Colorado Field Office Director and discussed ideas for HCB expansion to families. One of those ideas was a landlord education event that HUD can host alongside the Realtors Association, and that would gain interest from private landlords and developers. I began HCD expansion work by beginning that work plan, putting the discussions with HUD into action. I plan to resume the family working group meetings with the MKV liaisons, and those will begin next week. And that will really provide focused work for family systems. And for the piloting a peer support group, I initiated conversations with Colorado Mental Wellness Center, and they offer peer support groups. So just kind of discuss what their capacity would look like, what the partnership could look like, and those discussions will resume today.
Jessica, what's MKV? Sorry.
The McKinney-Vento liaisons.
Oh, okay. Thanks.
Sorry. And for year 3, completed action items, creating an online platform to request homeless services, and convening local healthcare providers to discuss street outreach team. And for planned, we have sponsoring a PSH feasibility assessment under developing a single adult system. So in progress updates for developing a single adult system, the convening a healthcare or hosting a healthcare convening that was completed as of yesterday. It was hosted at Arapahoe County, and partners that were present were the Stride Mobile Outreach Clinic, Doctors Care, Englewood Police Department, Advent Health, All Health Path, Arapahoe County Public Health, and this moved this in progress item to being completed. And the PSH feasibility is still in planning mode, and I will begin the work plan and movement on the PSH feasibility within the next 60 days, moving that from planned to in progress. So where that lands us now is at 60% of the action plan completed, 37% which is still in progress, and 3% that is planned.
I'm on mute. Julie, do you have a question?
Yeah. Hi, Jessica. Is the Lived Experience Advisory Board continuing to meet, and what does that look like right now?
At this moment, I don't believe they are meeting, but I can certainly get some clarification and follow up just to confirm that. But that's my current understanding.
Okay, because I mean, Mike led that group. I was with him at one time, and I think part of the advisory board was to like advise on this action plan, unless I'm mistaken. But I'd love to see that up and running again if that's meant to continue, or maybe it was meant to end when he left. But I'd love to hear more about that. And then can you say more about the peer work that you're doing?
Sure. It's still in the very beginning stages, so I'm still kind of exploring what that could look like. But what it would be is a peer support group to help families that are experiencing homelessness or housing instability, and kind of help reach those families that may go unnoticed or maybe a little bit harder to reach. The peer support specialist program would help them feel a little bit more comfortable in seeking services and talking to their experience.
So you'd be looking for somebody with lived experience of family homelessness?
Yes.
Okay. Yeah, as you get that up and running, I may have some recommendations. So I'd love to help with that as well.
Awesome. Thank you, Julie.
Mm-hmm.
Great. Sean?
Thanks, Mayor. And Jessica, thanks for the update. Exciting work. I just wanted to follow up on the kind of what the goal of or outcome of the healthcare providers meeting was. And, I'm glad that we convened that. And what can we expect to see from that in terms of benefits?
Yeah, thank you, Sean. It was a really there were a lot of fruitful conversations. It was really worthwhile. And I think one of the biggest things that all of the providers that came got out of the meeting was that they had some familiarity with Stride, which is the mobile outreach clinic. And I'd say about half of the providers there weren't familiar with them prior to going. So it really made that connection, and it introduced them to all of the services that Stride can provide and where they can fill in for some of the gaps that healthcare providers see. So that was the initial outcome of this meeting. I'd love to see it continued and to bring more partners to the table. I know Swedish Hospital is one provider that we'd love to kind of bring in. And I think what I took from everyone at the meeting is that they'd like to see it continued and maybe have that focused attention on serving our unhoused community and filling those healthcare gaps.
Yeah, that sounds awesome, and I hope that Swedish can participate in that. And I do just want to make a plug, Mayor, if I could, that Jessica and Emily Van Hake and Melissa Richardson from All Health all helped us with a presentation, Tim and I, to City Council on Monday night. Did a fantastic job on all things Tri-Cities from beginning to current, and did a great job. And Elizabeth Watts even made a cameo and helped us out, spoke to some of the work that she did in Littleton. But just thank you so much, Jessica, Emily, and Melissa. Great job. Thank you.
Absolutely. Thank you for having me.
Thanks, Sean. Emily, what do you have?
Yeah, I was just going to ask on the Swedish front. Jesse, do you have a lead on a Swedish contact? And if not, does anybody in this group? Because I'm with you about how meaningful it would be to have their participation in any capacity.
Yeah, I thank you for that, Emily. I don't have a contact with Swedish. I did meet with Craig Hospital, and they let me know that there is some transitioning with staff members. So they were going to attempt to get me in touch with one of their nurse leads. But yeah, any contacts with Swedish would be greatly appreciated.
I have the lead social worker's information that I can send to you. I haven't talked to him in a while, but I think he's still in that position. But yeah, this meeting has interested in engaging in this work. That'd be great.
Yeah, thank you, Emily.
Awesome. Thanks, Emily. Oh, and Julie says she also has contacts at Swedish, so maybe between the two of you can get Jessica in. Gretchen had a question she put in the chat. Is Stride able to serve the South Metro area?
Yes. So they can serve Englewood, Littleton, Sheridan, and the way they work right now is you can even give them a call like as something is developing, and they can come on site and help treat whatever medical condition is being needed.
Yeah, I think we had a discussion with them in quite a while now, I think. And at the time, maybe somebody else remembers better than me. I thought they said they didn't have a place with a bus in the South Metro or something like that. Emily's nodding. And so at the time, they weren't able to really provide services down here, but I guess maybe their situation has changed in the meantime.
Yeah, that's why I asked that question, because
Yes.
they weren't able to serve us. So Jessica, if you could get some clarity on that.
Sure.
I mean, you already know it, but send it to us.
Yeah.
Yes.
So we can make sure we're telling people that.
Yeah. Do they have like a certain schedule that they're here, or is it just on call? I guess we don't really know what they're doing around here, since it's obviously changed since last time we heard from them.
Yeah. Right now they don't, and Emily, correct me if I'm wrong, but it sounds like they don't have a set schedule, and when they'll be at certain places, it's kind of as the need comes up. But I should mention that right now, their van is out of commission. It's getting worked on. So at the current moment, they can't provide those services. But once their van is up and they're running as they intend to, it should be they should be able to reach our area. But
Yeah, and
I will get
piggyback.
clarification.
I can kind of piggyback on that too, because I guess they have multiple vehicles, and the RV style vehicle that they weren't able to bring down here because it had to be stored in a winterized location up north. That was the only place that they had that had like covered parking for them in a building because the vehicle wasn't winterized. That's what's out of commission right now and is under repair. But I think, Jesse, did they say they have some, it's like Sprinter vans that they're using, some different vehicles that they're doing still the mobile street medicine in? And they don't have a set schedule, but they kind of talked like they're hitting a lot of areas where there are known encampments that aren't in the Tri-Cities necessarily, like along Colfax and in Lakewood. But if we requested them to come to this area because we identified a need, then they said they would be happy to take that request and come provide services.
Okay.
So a couple of moving
Emily
parts, it sounded like.
has crisis services then taken advantage of that yet? Or a
We have not
correspondence or
worked
anything
with
like that?
them yet. Yeah,
Okay.
I haven't seen them in the community, and I don't think like MRU has partnered with them on any street medicine or outreach before. But they did clarify yesterday that if we called for them and needed them, because they can provide more robust medical services on the go than MRU necessarily can. Like the nurse can do some basic wound care and triaging of things, but Stride's mobile services, both in the van and in that RV, are more robust than what MRU could do. So it's at least good to know that if we call for them, that they have the capacity to respond. We just have to make the request.
Yeah, that's great. Jessica, could you maybe, if you have that contact info, or if you do, Emily, maybe you could send that out so we can have that at each city and some of our
Absolutely.
partner organizations in case somebody needs to reach out.
Sure.
Great.
I'll get that out.
And
after this
Jessica,
meeting.
is that also on our Tri-Cities website?
That's a good question. I'm not sure. But I can check into that and get back to everyone.
Great. And if it's not, can you get it on there?
Yeah, absolutely.
Awesome. Thank you.
Yeah, you can tell we're excited to hear that they actually can work down here.
Yeah,
We're looking
it
forward to
is
that.
exciting.
Okay, great. Any other questions for Jessica on the status on the action plan or anything she presented this morning before we move on? Nothing. Okay, great. We'll move on. We've got Kyla Moe. Is that right, Kyla? From MDHI with us this morning.
Good morning, all. For those of you I haven't had the pleasure of meeting, I'm Kyla Moe. I am the Deputy Director here at Metro Denver Homeless Initiative. And so I'm going to share my screen and do a real quick overview of the 2024 point in time.
Thanks, Kyla.
Okay, is my screen showing?
Yes.
Yeah, thank you. So just a high overview for those of you that may be new. The point in time is an initiative that we are required as the COC to do every year. And it is an unduplicated count of people experiencing homelessness on a single night in January. So HUD, the requirement is that we pick a night in January, the last 10 days in January. And we, it doesn't have to be the same day every year, but just it has to be within this last 10 days of January. And it counts those that are defined, meet HUD's definition of literal homelessness, which is they're living in a place not meant for human habitation, emergency shelter, and some transitional housing projects. Those that are at risk of being homeless or those that have been matched and are currently in a housing opportunity are not counted in the point in time count, but there's another report that we do at the same time, which is called the Housing Inventory Count, or the HIC, and that's where we would get those that are currently in housing on that count. Really how it works is we collaborate with partners in all 7 counties and 9 regions to work with the community leads and the agencies and partners in the community to conduct the count. And there's multiple methods. There's, if the agencies are using and the programs are using HMIS, we will pull the data directly from HMIS, and there's really no effort that those programs or agencies need to do outside of making sure that HMIS is up to date and accurate. And then for those that don't use HMIS, we do mobile surveying. So it's really a survey that volunteers go out and do either at the on site at the shelter, or the street outreach teams or volunteers do to capture those that are unsheltered. So that is done, again, kind of a multi-approach, and that's where we work with you all. And Jessica is the liaison for you guys this year. Is we will work with Jessica, and we actually have our PIT planning kickoff meeting this afternoon. So it's a day of PIT planning today to coordinate those efforts. So to work with the shelter providers to make sure that they have the mobile survey if they don't use HMIS, and then also to help recruit volunteers and train volunteers to conduct the unsheltered survey portion of it. We know, given that it's just a one-night count, that there is some limitations to this count. So, we just like to plug that. And it has, numerous variables for that could change from year to year, such as weather, volunteer engagement, kind of capacity. And so, we just like to do that caveat. It is a data point, though. It is a way that we can look at, what is the state of homelessness on that night in our communities. But we try to then pair it with additional data that we pull from HMIS, we get from McKinney-Vento, other resources to create our state of homelessness report. And so if you guys haven't seen the state of homelessness report, that is on our website, but that's just kind of our plug of point in time is one factor, but we know that there's some limitations to this count. And then I'm just going to go through some high level, the data from 2024. And so overall in our region, we've seen a total of almost 10,000 people experiencing homelessness on January 22nd of this year. One note is the newcomer population that we saw an influx in Denver County is not included in this count. For HUD purposes, it is included in our HUD reporting. So if you were to ever go to a HUD website and say, I want to pull down Denver's PIT numbers, and then you go to the MDHI website, you will see that those numbers don't match. And that is why, is by HUD's definition, we have to include them in the count. But we as a continuum have chosen not to report them in our local county. So that was just a note for difference. Of the roughly 10,000 people, the majority of those were in shelter. So 7,000 of them were in shelter, and about 3,000 of them were unsheltered. Kind of what we look at, there's we collect several factors in addition to what HUD requires us to collect. So one of the things that we collect is we ask what are the reasons that contribute to somebody experiencing homelessness. And so this year, the top 5 reasons we've seen across the region were, they lost a job and they couldn't find work, they were unable to pay their mortgage or rent, the relationship problem or family breakup, alcohol, substance use, and then either asked to leave or evicted. So again, that's just kind of the top 5 reasons we've seen across the region. And then just kind of breaking it out by population and demographics. 64% of those experiencing homelessness were adults only, 32% family, and then 4% is the youth only households. And then we do. This is just data to show that we do show an overrepresentation of those experiencing BIPOC in the homeless population in the count. So that's just kind of a breakdown of that, the racial disparities that we do see and we continue to see in our data. High level characteristics, 1 in 3 experienced homelessness, a new episode of homelessness, and the definition that we use for this one is for point in time is that they were new to the system. If we pull it from HMIS, it's new to the system from last year's count to this year's count. And then for the mobile survey or unsheltered, we ask them, is this your first time experiencing homelessness? And so that's where we get the newly homeless. We have the chronic homelessness, so 1 in 3 are also chronically homeless, and 1 in 4 self-identified as having a chronic health condition. And then just real quick, I'm going to do it by sub-region, broken down. Adams County, seen about 920 people. Arapahoe County, which your data is a part of, and I'll separate out I have a slide for Tri-Cities data. About 650 people experienced homelessness in Arapahoe County. Boulder County saw 727 people. Broomfield County, 86. The city of Aurora, so their data, just a note, because it kind of gets confusing as well, and it's similar for you all as well, for the Tri-Cities data, is we report it at the county level, and then we do break out for the subregions. So your guys' data and the city of Aurora's data is also included in the counties. So we don't subtract it from the counties, it's also included. So just a note of that, to add it, if you add it up, it's not going to equal. We don't subtract it, we just kind of pull that out for representation. And then Denver County, you know, as we know, those that in our region, that county is the highest percent of people experiencing homelessness. So they saw about 6,500. Again, that does not include the newcomer population that was housed in their stand-up shelters that they put up for the temporary. Douglas County had 80. Jefferson County had 925. And then here's your guys' data. So roughly about 200 people identified as experiencing homelessness in Inglewood, Littleton, and Sheridan. 25 of those were sheltered, and 175 of those were unsheltered. And then kind of breaking it out by the 3 cities, 75 people in Inglewood, 121 people in Littleton, and 4 people in Sheridan. And then we do have more reports, or you can, access, we have a PIT dashboard if there's any additional information that you want to like break it down by. The PIT dashboard is on our website. And then I know I sent some additional data to Jess already, but if there's additional data points that you all want that's not on our dashboard, we're happy to provide that. You can just submit a special data request, and we're happy to provide any kind of breakdowns. Any questions on the PIT data?
You have those breakdowns by the Tri-Cities and the individual cities on the website or the dashboard as well?
So we did add, we added something. We will be adding city to the dashboard. It's not on there yet, but okay. I did send Jessica some breakdowns by the cities. Okay. So she has that data.
Great.
But in future, we are going to be, right now it's just county level and the city of Aurora on the dashboards, but we are going to be adding a city field next year for the dashboard.
Great. And is that something, have we put that on our website before? Somebody remember? Is that out there? Or maybe we could attach this this presentation out there for people's information. I don't know. What do you think, Jessica?
I've included the data in the July dashboards.
Okay.
So those are posted to the Tri-Cities website. So they should be, the number breakdown should be available on Tri-Cities.
Yeah, and if we could get a copy of your presentation, Kyla, that would be great.
Yep,
Julie, go ahead. Sorry.
Thank you so much for that data. I was wondering, Kyla and Jessica, as you meet to plan for this region, if you all could reach out to Hat Force and see if they're able to be open for the point in time count no matter what. That came up last year because if they already have funding and they're able to just block that out for that night, that would be great. And if not, if we could look at funding, because I think in the past sometimes they're closed and that makes the count harder for this region. So since they're sheltering, doing such a comprehensive shelter of families and individuals, it'd be great to see how we could partner with them to make sure they're open for that event.
Great, thanks, Julie. Anybody have questions or takeaways? Go ahead, Gretchen.
The Littleton number, does that include Littleton proper, or just all of people who have a Littleton address? Was that all of the west part of kind of our area north of 470, east of the foothills, or did it actually include just Littleton?
So on the tracking down to the city level is something that we've been continuously working to improve every year. In previous HUD just requires that we submit an aggregate level, but to help work with the communities, we broke it down to counties, and now we're getting more requests to breaking it down to cities. So we're working to continuously improve to get the data more at the granular level. So right now, how we get the city data is on the mobile survey. So for unsheltered, we ask the volunteers, what city are you in? And they say Littleton. So I can't answer that question, Gretchen. I guess it would be in like the planning phase for you all, is to make sure that you have volunteers in all of the appropriate regions, so that you do make sure that you get coverage, as much coverage as possible.
Okay, thank you.
And we tried doing like a pinpoint, last year, I think it was, or 2023, is we tried to say, here, volunteers, pinpoint where you're at. And we can pull a geocode so that we could tell you exactly that information, Gretchen. That didn't work. And it's just because of technology, and, you have to have mobile, and it was, something, again, that we tried and learned that the data wasn't accurate. So that's why we just go at the higher city level. We do have a question on the survey that asks, they can, and it's optional. So we get a lot of blank fields. We ask them like for cross streets. So that's another way too, is like if there's some more granular information that you all would like to be able to collect and report on, that's something that you guys can work with Jess on, and then we can work on seeing about how we can incorporate that into the count on 2020 in 2025.
Thank you.
Thank you.
I know one of the things that stood out to me, and I think we know we still have a long way to go in the Tri-Cities, but the Tri-Cities in Arapahoe County still have the vast majority of our homeless unsheltered as of the count day. That really jumped out to me compared to some of the other, regional partners and municipalities, that they have so many more people in shelter as of that count. So I don't know, that stood out to me. Remind us what we need to do. We had a question in the chat from Linda asking if you can give an update on the search for the executive director for MDHI, Kyla.
Yeah, I'd be happy to. Any other pit questions before we switch gears? Okay. Yeah, so the MDHI's ED search is underway. We conducted round 1 interviews and have narrowed down the candidate pool, and will be starting round 2 interviews the end of October. So, it's moving along. We have, a good candidate pool. So are very optimistic and positive that we can get somebody in and on board and started by the end of the year, beginning of next year. In the interim, Rebecca has graciously agreed to stay as the interim ED. So Rebecca will be with us until the new ED is hired and that transition takes place. Did I say end of October? Sorry, it's early. Interviews are end of September. Thank you, Linda.
Okay. Awesome. Well, I'm glad Rebecca's willing to stay on. That's great.
Yeah, it's been a huge help.
Great. Anybody have anything else for Kyla or about the pit before we move on? Thanks again for being here, Kyla, and for subbing in last minute for Rebecca since she's not feeling well.
Of course.
Okay, well, thank you. And we'll move on to our last topic for today, and that's the safe parking discussion. We have Jessica to lead that, and we also have 2 folks on to join in on that. We have Linda Behringer and Terrell Curtis.
So as I mentioned, we did have our kickoff meeting on, I believe it was the 4th. And Terrell and Linda did a really wonderful job of just giving a really in-depth overview of safe parking, what it entails, and what's kind of needed for a successful safe parking lot. A few of the key points were the basic needs for a safe parking lot, which is the parking lot, the porta potties, and a hygiene station. Anything in addition to that isn't required. Those are the bare minimum basics. They also spoke to where these safe parking lots can be, some of which are at faith-based locations, while others are at nonprofits. They discussed one that's at Salvation Army, which is really beneficial because Salvation Army can provide the case management And the case management is one of the more expensive costs of running a safe parking lot. So there's a lot of different avenues in which the safe parking lot can be run. They also spoke to the case management, which is a really vital component to safe parking. It helps the clients support employment, healthcare benefits, and also secure more permanent housing. Another thing that they touched on was the lot sizes. They can run anywhere between 3 to 15 vehicles, but the ideal size being around 10. And then they spoke a lot to some considerations for identifying a safe parking lot and a successful one, the positioning of the porta potties and where they can be set up, lighting, appropriate lighting that supports safety and security, and then placement of the lot in the surrounding community. So specifically, they're looking for if there's schools nearby, businesses, if it's residential. And then another big topic that was discussed was the zoning permits, and those can present as a barrier. So it was agreed upon that before the next meeting, each city representative would come back with anything that could be a barrier in their zoning regulations. So for the next meeting, we'll discuss the zoning regulations between Englewood, Littleton, and Sheridan, determine if there are any barriers to those regulations that may present. And the other question that was asked was the parameters around the county funding. So Lizzie from Arapahoe County will come to that meeting to discuss the funding that was granted. So that's where we stand now. I don't know if I'm missing anything. I don't want to put you on the spot, Linda or Terrell, but please feel free to jump in if there's anything that I missed there.
Teams. Good morning. I think that pretty well covers it. I sent everybody this morning. I'm Terrell Curtis. I'm the executive director for CSPI. My colleague Linda, for me, is down there. But I sent everybody this morning an FAQ that we developed based on a lot of the questions you all had when Mike Sandgren was still with you. And so you should have those in your inbox. Happy to touch on any of those specifically more. Currently, as Jessica has described, we've gotten a late start in this year around our work with Tri-Cities, but it's great to have that subgroup to really focus our efforts. I feel like we have a good motivation going forward and lots of momentum. So happy to have any questions. Linda, is there anything we need to add from your end?
Only just a point of interest. I think in the point in time data that Kyla just presented, there was 77 vehicles counted in Arapahoe County. I don't know about the Tri-Cities in particular, but in Arapahoe County, there was 77 vehicles that night counted, which is significant, I think.
Well, and one of the other sort of the contrast to that, and we haven't pulled the data down specifically on our end, but last year, CSPI received over 1,700 calls for assistance from across the metro area. And I think the point in time shows something around 2,500 people who are unsheltered across the metro area. So I think that demonstrates the extent to which we know the point in time is an undercount. There's just people, especially people in vehicles, really want to stay out of sight, particularly because it's not legal anywhere and they just don't have any other options. So they're kind of hard to track down. So I think that kind of helps demonstrate that we counted 77 vehicles in Arapahoe County, but there's almost certainly more. Julie, you have a question?
Yes, and I hope you didn't already say this. Is there a goal date for when we hope to have one set up, or you're just meeting ongoing to look at a location?
So there's not a goal date yet. I think we might be able to get to that next time we meet. there's a lot of work to be done in the first place. None of your cities have the legal zoning that would allow safe parking right now. There's certainly some ways to approach that with emergency ordinances if a city is willing. We do know that we have a couple of really eager sites in Littleton. They're both at churches that have been kind of chomping at the bit with us for quite a while. So I think there's some real potential there. We also want to make sure that all your constituents that are most interested and concerned with a potential safe parking program, we want to make sure and help you all to give them the best information as to what safe parking is, what safe parking isn't, and how it may or may not impact their community.
Okay, thank you.
Of that 77 that were in the point in time count in Arapahoe County, could you drill that down and get us the Tri-Cities? That's going to be really critical as we try to convince our city councils to change zoning, which we have pretty, I felt like last year we had pretty good support when we met all three groups.
Mm-hmm.
So it's really a matter of just showing, hey, this is the numbers. And I think that shouldn't be a huge barrier, at least as an emergency ordinance, because that gives us, it doesn't have to be permanent. But having that actual number of how many people are we talking about would be really helpful.
Yep, as Kyla mentioned, they're working on making these numbers available by city. So we'll be working closely with MDHI on that.
Excellent.
I'm sure they have so many requests for very specific data that hasn't been specifically pulled out yet. And actually this year, I'm having done this for a really long time in Denver. I'm pretty impressed at the extent that they've been able to really provide us with the tools to customize our searches for data. So we'll get there.
And just real quick, don't publish these numbers and definitely submit a data request. But if I pull it right, again, I'm doing it on the fly, so I want to double check it. It looks like 47.
47 where, Kyla?
In the Tri-Cities that were sleeping in a vehicle.
Oh, okay. And then
again, that's just real quick. I would want to have a formal request to kind of look at it to make sure I got it right.
That's a really good start. I think what I'm hearing Gretchen say is maybe drill down even a little further to the specific cities, which one is which, because they will all have different existing zoning regulations, different processes for getting new zoning.
Great. Jessica put in the chat, she's going to follow up on those data requests so we can have that information. Thanks, Jessica.
Thanks.
Okay. Other questions? I'm really appreciative of that subgroup. They sounds like you're making good progress with them on this topic. So thanks to those of you who are involved in that group. Appreciate it.
If anything comes to you later, you have both our emails. Please reach out through Jessica. We're happy to help.
And thank you for sending along your notes on where we're at. I appreciate them as well. So everybody should have that in their email. If you don't have that email from Terrell, you can contact Krista, and assuming she could make sure you get that. You're probably not on our distribution if you didn't get it. Okay. That's it for our formal presentations for today. So we have a little extra time. Is there anybody who has anything they want to bring up for the group today? Anything in your organization that's going on that you want to share? See any hands coming up? That's fine too. Okay. We'll give you some time back then, and our next meeting will be on October 10th. So I'll see you all then. Thank you all. Appreciate it.
Thank you.
Bye.